So 1 in every 40 people approximately have OCD. I've never even heard of anyone getting like professional help for OCD, but that might just be because of the stigma of mental health and how people don't talk about a lot of the treatments they're going through. But I have been diagnosed with OCD. I used to joke about that I had OCD every once in a while, and I've heard things like, oh, you don't have OCD because your car's messy, or oh, you don't have OCD because of this or because of that. A lot of people tend to think that OCD just has to do with being clean, and that is not the right definition. OCD, just like how ADHD isn't all about attention deficit, they can actually hyperfocus and have lots of attention. But OCD, it just gives you any kind of compulsion. So you can completely have a messy house but have to wash your hands every single day. Like multiple times at every single time that you touch something, or if you're in the bathroom, you're compelled to wash your hands over and over. Some people until they bleed or until they're raw. And luckily I don't have that aspect, but it's just like a lot of other mental disorders where it's not cookie cutter. One person who has OCD is not like the next person who has OCD. So I can see how treatment really has to be tailored for the person. There's not a blanket here, this is how you get rid of OCD. And a lot of people can't really necessarily get rid of it, but they learn how to cope with it. This is one way how I'm coping with it, because I have obsessive picking disorder, where 3% of the people with OPD have OCD, and that's what it's caused by. I remember having this from when I was a child, and it's just different body parts over the years. When I was little, I would pick at my knees. Like, I remember one of the very first thoughts that I had related to OCD was I have to pick every scab 3 times, because if I don't pick it 3 times, it will never heal, which really doesn't make a lot of sense. But when you're 8 or 9 years old, you don't know any better. So it went from my legs. Then when I was 18, I got laser hair removal, and that really helped any kind of blemishes. They're not there anymore, because the problem is that your fingers are searching for any kind of blemishes on the skin. So I have dogs. I'm allergic to my dogs, so my face breaks out a lot. I'm sure I had regular genes of acne to begin with, but I'm almost 30 now, so I still break out because I refuse to give up my dogs. Well, what I was finding is that when I was in traffic and I was really stressed out, I would start scratching, or just start feeling my face, and I would feel like little imperfections and just start scratching at them and completely not realizing what I was doing. And I would look down at one point and just see blood in my hands. I'm like, oh my God, I can't do this. I would try sitting on my left hand and only driving with my right hand, trying to keep both hands on the steering wheel at all times. And sometimes you just put one hand down. Well, it's totally subconscious, because within 5 minutes or so, my hand was back up there doing it again. I caught myself, there's blood everywhere again. It was just an endless cycle, and I didn't know what to do. So one thing that I found in dealing with my OCD, once I figured out that it is a real thing, I used to just joke about it. Oh, you know, I like things clean. It's so much more than that. It's just, and I've been reading a lot that it can change. Like every few years, people's tics can change. Like I used to pick at my legs, and I would pick at my arms, and so I tattooed my arms so I wouldn't pick at them anymore. And then it goes to my face. I know that I've picked my face off and on throughout my whole life, but it gets so bad that nobody understands. I'll be in front of a mirror for 30 minutes to 45 minutes a day, just picking at my face if no one's there. I used to have an ex-boyfriend who he kind of knew what was going on, but not the psychology part of it, and he would stop me, because literally I feel compelled to stand there in front of the mirror and check and just check and check and check and get any kind of like blunt, just check constantly, and I can't pull myself away most of the time. Like somebody literally needs to come over and pull me away. Mostly and has me stop is after like 30 minutes or 45 minutes, my knees hurt so bad that it's hard to stand up and it's hard to like walk away from the mirror at that point. But it hurts. But either way, so the point of the mask and driving is that sometimes, the first time I did this, I wore the mask for maybe a month or two every single time I was driving. And not only do people let you into traffic faster, which is freaking awesome in Orlando, and my neighbors avoid me, which is awesome too if I'm walking around the neighborhood, but I can't. It's in the way. I can't pick at it. So it was an easy way to get myself to stop the habit. Then I found that once I-4 construction started again, I started doing it again because of how stressed out I was in traffic so much, especially since you're not really moving. So I've started wearing it again. I didn't have to wear it for about a year. So my point is that if you have OCD, don't just try to make yourself normal. Making yourself normal is probably the worst thing you can do. It will hurt. It'll like literally hurt you in your chest to just try to make everything normal. Some things okay, but on the blanket, really what you need to find out is what makes you feel better. So I don't have to make myself feel bad because I'm constantly scratching my face and making myself feel like shit. Dude, what are you doing, man? You know how a lot of people say to go with the flow? That's basically what you need to do if you have OCD. If you feel compelled to do something, try to find the healthiest way to do it. So I feel compelled to scratch my face. I've tried and I can't really stop it. So what am I doing? I'm putting a barrier in place. At home, a lot of times when I find that I'm really in a bad part and I'm in front of my mirror 30 minutes, 45 minutes a day, just ruining my face, I take down all the mirrors in my house. People come over, they don't see a mirror. Too bad. Like, this is just how I'm dealing with my medical issues. So don't be afraid or don't be ashamed or whatever. Like, would you rather me stand in front of a mirror for 30 minutes every day ruin my face, or would you rather not have a mirror in a house that, you know, these other people don't live in, so they're just gonna have to deal with it? Like, you just need to make changes so that you can live your life easier. It doesn't mean that people without OCD, it makes their lives easier, but luckily I don't live with anyone. So I'm able to modify my life how I want. A couple years ago, I also gave in to labeling, and I just labeled the things I want to label. Forget who everyone thinks that I'm an Alzheimer's patient or something, but if I want something labeled, I'm just gonna label it, because why fight myself? Why punish myself when that's not the easiest route? You can't give in to everything, because the more you give in to really bad things, the more it controls you. So if I said, well, forget it, I'm just going to give in to picking my face and I'm just going to let myself do it, that's not the solution. So it's one of those things where you really have to pick and choose your battles. Who is labeling my drawers in my house hurting? No one. Who is getting hurt by me picking off my face? Me and everyone that has to look at my face. So this protects me, and it's $2.97 for a box of 20 at Walmart. But not everyone needs to do this. Not everyone has this problem, because it's even like less than the 1 in 40 has OCD, but not everyone who has OCD has OPD. The biggest stigma is that the other 97% of people who have OPD are also drug addicts, meth heads, that kind of thing. So when people see my face, they kind of think that, oh, well, she must be on some kind of drugs, or at least I fear that. But that's not, this has been my problem since I was little, and I'm trying to, work with it. I go to a facial lady every once in a while, and she really helps, heal some of the things that happen, and I'm about to try to get allergy shots, but none of that takes away the OCD and the OPD. There'll always be something else. If I conquer this, there'll probably be something else I'm going to have to conquer. Hopefully I don't go back attacking my arms or anything, but even if you conquer something in your OCD and then you see another thing pop up, that's just how it is. You just have to keep putting out the fires. And as long as you keep putting out the fires, let's just hope it doesn't turn into a big old forest fire because you stayed on top of it. And every new challenge, you find a new way to solve it for yourself. So I don't think that very many of my friends have the OCD as bad as I have it. And a lot of people don't realize how bad I have it because they might see my house and, you know, on a day that I'm doing a whole bunch of artwork and having a major ADHD day. So I'm like two exact opposite brains in one. But, so I don't know how many people have OCD and they don't talk about it. But I do feel that, like, you know, the more you talk about it and connect with other people, the more you can realize that you're not alone. And they may have solutions that you don't have, and you may have solutions that they don't have. I've been going to a lot of doctors, but mostly we only talk about like depression or ADHD. OCD doesn't get talked about that much, because even I'll say that I really am blessed that I do have OCD because of how bad my ADHD is, that it's kind of like I clean up after myself. So that's great. But it's things like this that get in the way of me literally living my life. Because you just get such a, like, somebody, either you want to rip open your chest, like where your sternum is, and just rip it open to let the pressure out, or you just want to, like, just stop your heart or something. Just anything to make it, that pain to stop. That pain is caused by not fulfilling whatever compulsion you have. But as soon as, you know, you can walk away after a couple minutes, even like literally 60 seconds or 120 seconds, a lot of times it's gone. But pulling yourself away is just, it's so hard for someone with OCD. Like, it literally feels like we're pulling body parts. So next time you joke around and talk about somebody's OCD, kind of think about the fact that it's not as playful as a lot of people say it was. I'm guilty. I'm one of the people that, oh yeah, I have OCD, or you have OCD because you like your desk clean. It's a whole other world of just control and lack of control and rituals and that kind of thing that you just, that's all in your subconscious. So you don't have a whole lot of control over it. But if you do just take one problem at a time and do the test of, is this something I need to fight, or is this something I need to solve, or is this something I just need to live with, then that's where you need to go with it. Either try to fight it and get help, or try to solve it and find ways where you can live with it being okay, or it's one of the things where you don't fight. Like how my closet is organized by length and color. I don't fight that. It helps me. It helps me in the morning because I don't like to think in the morning, and I like to just grab whatever I need to do to get dressed. And I don't like to think about it. So if it's all in colored shape, I'm good. So that was just my 5 seconds or 10, 13 minutes worth of rambling. Bye.